A root canal is the removal of a tooth's nerve in order to treat or prevent an infection and thereby preserving the tooth. I perform my root canal procedures using a microscope. These advancements have allowed root canal treatments to be more accurate, efficient, and give us a higher degree of success. When a patient presents in my chair, we do an evaluation, we confirm the diagnosis, and we confirm if the root canal treatment is the best option. If it is indeed determined that it's the best option, then it's always better to preserve your own tooth rather than extract it. Sometimes patients can present with sensitivity to biting or hypersensitivity to hot and cold beverages before needing a root canal treatment. If you experience any of these symptoms, it's very important to come in for a consultation before the symptoms get worse. If you are experiencing these symptoms, it's important that you come in order to save this tooth. Otherwise, the pain can worsen, or you can develop swelling or a very bad abscess.